Yeah, we have to follow that. Really?
Sorry, good job, Dennis Ward.
Well, Novant Health has owned Franklin Medical Center since October 2009. But we did just go through a rebranding in April. So a lot of people think Novant Health is new to the community, but we've actually been here for a little while. So we're going to do a little overview just of Novant Health, the system, and our hospital in Louisburg.
Baby pictures.
Yeah, and I'm sorry, she'll flip the pictures for me.
Yeah, y'all use a lot of imagination. You ready?
We'll send out the presentation after the meeting. So
Yeah,
we'll
absolutely.
so we'll get it out there, buddy.
Voila.
So we're a system. We have hospitals, physician practices, and imaging centers through Georgia, South Carolina, North Carolina, and Virginia. We are opening a new hospital next week in Haymarket, Virginia, which is very exciting. And the point of the rebrand was that you would see, wherever you saw the Novant Health sign, you would know that that was a place you could go for remarkable care.
So can you see the H? That's the tricky part.
It's the hidden H.
And an invisible H? I know, we all do it too. Really?
I didn't see
Invisible H there with the 2 dots.
It's easier to see on the purple.
Right.
I
See
think.
it in the purple? You maybe can't
it's
see
easier
it.
to see.
Here, have that piece too.
We should have outlined it.
I think the pages are numbered. They'll come back together.
We operate under our mission, vision, values, and since it's not on screen, I'll just read. The mission for you is Novant Health exists to improve the health of communities one person at a time. And we, the employees of Novant Health and our physician partners, will deliver the most remarkable patient experience in every dimension and every time. If you ask a Novant Health employee what their job is, they will say deliver remarkable care. That's our #1 job. And we really do believe that. We had last week I wrote a story about some nurses in our new geriatric behavioral health unit, and they have been collecting cans from the unit and turning them into the recycling center for money and using that money to buy games and crafts, decorations, and even in some instances clothes for their patients. So that's just one example of going above and beyond for our patients. And in Franklin County, we employ 146 residents. 106 of those 146 that live in Franklin County, 106 live in Louisburg. The annual pay base to the Louisburg area is $5.74 million. And Louisburg employees account for 67% of our payroll dollars at Franklin Medical Center. Novant Health has one of the most generous charity care policies of all health systems, and actually the 3 top hospitals in the state in charity care are all Novant Health hospitals, and Franklin Medical is somewhere in that top 3. We're not #1, but we're either 2 or 3. I can't remember which one. But in 2012, we spent $3 million treating charity care patients. Unreimbursed costs of treating Medicare patients, these numbers are from 2012, was $5.3 million. And our total community benefit in 2012 was $10 million. And that all went to Franklin County. So then Lily's going to talk a little bit more about our hospital. And for Lily is our chief nursing officer at Franklin, and I'm public relations and marketing.
Yes, thank you. Some of you already know, so don't be telling everything you know about me first. We'll talk later. To serve our residents of Franklin County and the surrounding areas, and I'm sorry you can't see this, it's a lovely picture of the logo again. They're 83-bed facility here for your service in Franklin County and the surrounding area. You know we have the 13-bed behavioral health unit that just opened last year. And so we still have beds open, not that I need to recruit all of you, but just to know that there is a place for us to take care of people. Please feel free to send them. We also have surgeons. We've done around 1,500 surgeries last year. We actually had about 18,888 Emergency department visits. That's a lot of visits for a very, very small facility. So it's around 55 a day, 57. So in a 24-hour period. In 2013, we had 1,922 that came from mammography. So a lot of people doing different things. And I will tell you how proud we are to be there and talk about our quality of care. I realize you won't be able to see this across the room, but I'll be glad to pass it and we'll send you this information in detail. We had the opportunity to be compared in 2012, and of course we do this every year, it's on the website. We actually are compared with Wake Med, Rex, and Duke Raleigh. And at this point, we had medication always explained. We were able to exceed that. Patients always receiving help as soon as they wanted. Nurses always communicating well, and always, gosh, that's hard. Everything you do always, so I was very impressed. Area near the room is always quiet at night. Patient's pain is well controlled, and the rooms are always clean. During that time period, we were able to lead those other facilities in our responses from patients. So this isn't that we made this up. Patients actually responded to this for a survey. And it's on the website, so it's out there for the world. When you're ready to come see us for your services, things that you might look for, 24/7 lab, emergency department, as well as imaging, which means we can do your x-rays and take care of those pieces. We have inpatient units for med-surg. We have a step-down unit, which we say PCU. We also have an intensive care unit. We have cardiopulmonary, which means we can take care of your heart and lungs. We have sleep services. So if you need a sleep service done, a sleep apnea test. We have rehab and therapy, certainly surgery, diabetes education, and a behavioral health unit. So we are very blessed.
A lot of people know this, but we have a sleep lab in the hospital where people can actually spend the night
Here in the
to
county.
have sleep tests done.
You don't have to
It's
drive.
on our 3rd floor.
Yes, it is. And of course, as you know, we are very quiet. If I see you in the hospital, I will speak to you. If I see you as a patient in the hospital, you will never know it unless you tell us. So thank you for thinking about us when you need your services.
So Lilly mentioned this. In January, we opened a geriatric behavioral health unit, 6,000 square feet, 13 beds. It helps adults 55 years and older recover from mental health crises. It was a $2.8 million investment in this community, so we plan to stay. And our next expansion project is we are seeking approval to build a surgery center in Youngsville. We have one operating room that has been approved for Youngsville. We have an unused operating room in the hospital that we want to move to Youngsville to have a 2 operating room surgery center in Youngsville. Like Roger said, we had that hearing in January. And we had, out of 24 speakers, 20 spoke in favor of the expansion, which was
Impressive.
Impressive, yeah, that made us feel good about it. And so that decision will come out sometime towards the end of April.
And for those of you that were there with us, thank you so much for your
Yes.
support.
Thank you.